Why is autosomal dominant genetic testing complex? Imagine trying to solve a puzzle where some pieces look alike but fit differently, and others are missing altogether. That's what makes testing for autosomal dominant traits so tricky. Autosomal dominant means only one copy of a mutated gene on a non-sex chromosome can cause a disorder. If a parent has the mutation, there's a 50% chance it passes to each child. But not everyone with the mutation shows symptoms, which makes predicting outcomes hard. This is called variable expressivity. Some people might have mild signs, while others have severe symptoms. Plus, some carry the mutation but never develop any signs at all, which is called incomplete penetrance. These factors make it tough to tell who will actually get sick. The mutations that cause these disorders are very different. One disease might be caused by many different mutations in the same gene, or similar symptoms could come from mutations in different genes altogether. Detecting all these possibilities requires very thorough testing, like sequencing entire genes or multiple genes at once. Some mutations are rare or specific to certain populations, adding more complexity to designing tests that catch everything. Most genetic tests focus on the parts of genes that make proteins, called exons. These areas contain about 85% of mutations that cause disease. But mutations outside these regions, or large structural changes like deletions, can be missed. That means some mutations might slip past the test, making results less complete. Testing also faces practical hurdles. Not everyone has access to specialized laboratories or genetic counselors who can interpret results correctly. Sometimes, emotional fears about discrimination or stigma stop people from testing. They worry about how a positive result might affect their job or insurance. For families, understanding these challenges is important. While testing can identify who is at risk and help with early health decisions, it's not always straightforward. Results need careful explanation by genetics professionals to avoid confusion. Genetic counseling helps families understand what their results mean for their health and their relatives. In the end, testing for autosomal dominant disorders is complex because of how variable the symptoms can be, the many different mutations involved, limitations of current technology, and practical barriers. All these factors mean that interpreting test results requires patience, expertise, and clear communication to give families the most accurate information possible.